Hello and a warm welcome back to Autism Unpacked. I'm Rosie Moss, and today we're diving into a topic that sits at the heart of so many families' experiences. Questions. When your child is diagnosed with autism, or when you suspect they might be, it can feel like the questions come thick and fast. Today's episode is a parent Q&A. We're taking some of the most common and often most worrying questions families ask and unpacking them calmly, clearly and honestly. I'm really pleased to be joined today by Dr. Freya Spicer-White. Dr. Freya brings both professional expertise and lived understanding to this conversation. She works closely with autistic children and their families, supporting them across diagnosis, education and everyday life. And she is deeply passionate about helping parents move from confusion and fear towards confidence and clarity. Welcome back, Dr. Freya. It's so great to have you here.
Thank you so much for having me, Rosie. I'm delighted to be back and delighted to be talking about something that's so important for our families and young people.
What does autism mean for my child? To begin, let's answer some common questions around the early signs of autism. What to look out for, what these signs can mean, and what the next steps might look like, and whether autism can also appear in siblings within the same family. Whether you're just beginning to ask these questions or are looking for better understanding, listen in for some answers to support you through these early stages.
Let's start off with the first question. If I'm noticing behaviours in my child that make me think they might be autistic, what should I actually be looking for? And what's the next step if these concerns don't go away?
Right, okay, so that's a really good starting off question because it's right at the beginning of a parent's journey when they might be beginning to notice some of the things that their child or young person is doing might be slightly different to some of the other children that they're around, maybe their siblings or their peers at school. So what I'd be saying to look out for are those sort of subtle differences. So what are the things that maybe are causing that parent some concern? So it might be that the young person might be struggling with some friendships. They might not quite understand some of the social rules. They might be engaging in behaviours which look a little bit different again to other people around them. They might have some really intense interests or passions. So there might be something that, goes above and beyond a kind of like a typical childhood interest. So an example I always give is, maybe they might have an interest in horses and their friends, teenage girls always like horses. So there might be a whole collection of young people who like horses. But your daughter absolutely loves horses. All her magazines are about horses. All her room is decorated in horses. And she's, when no one's looking, she's practicing cantering and doing all of those things. So it's noticing that those interests are maybe above and beyond where her peers might be. It's also looking for things like changes to their routines. How does that impact them? Any sensory experiences that they're having. So is there food differences? Is that more than just fussiness? Yeah. Are they actually really struggling with some things like clothes, textures? So there's a whole collection of things that you might be wanting to look out for. And maybe one of those things might be, a standalone thing, but it might be when you start putting it all together that you start to think, oh gosh, there's something here that's impacting my young person. So if you start to notice that, what I would say is kind of maybe start to keep a journal or a kind of just some notes, just so if you're going to go and talk to a professional, so maybe you might start with your school nurse, you might start with your school special educational needs coordinator, so your SENCO, even your class teacher or your GP. So you might go and start having those conversations. And because you've kept those notes, when they start asking you questions, oh, do they do this? What about this? You can then start to kind of have those answers ready.
Because it's quite difficult, isn't it, once you get to the doctor's surgery to remember all that information. So by creating a log, you've documented it, you've got some evidence to present.
Exactly, yeah. Because I think as soon as somebody puts you on the spot and says, well, what about this, what about that?
Yeah.
You might be like,
mine goes blank, right?
Yeah, no, can't think of it. Whereas if you've got that all written down, you can then start to explore that with somebody. And because they're a professional and they have skills in that area, they'll know what to look out for and they'll know how to maybe ask you some more questions along certain things and different lines. So an example just that's very recent to me, and that's why I'm smiling because it's a really lovely one. So a young lady and a mum who I was talking with recently who were thinking about exploring an autism diagnosis, and I said, do they do any repetitive behaviours? And mum was like, oh no, not really. And then afterwards, mum rang me and said, oh, actually, I've just remembered she does lots of repetitive behaviours with her dog's name. So she repeats her dog's name over and over in lots of different ways, lots of different voices. And I was smiling because that's something I do very much. So it's looking at things differently. So sometimes you might have a trait that doesn't immediately jump to mind, but then when you start reflecting on it, you're like, oh, yes, actually, I think that they do this in this situation or do that in that situation.
Fantastic. Thank you very much. Now, Freya, you mentioned actually about the crossover with things like ADHD. Now, is that something that parents will often see? I mean, is how common is a crossover with something like ADHD, dyslexia?
Very, very common.
Very common.
Yeah. Rosie, we used to think that young children who had two maybe conditions or two or more, we used to think that they were the rare young people, that there was only a few of those. However, what we've done over the last few years, and the more we've researched and the more we've understood children's profiles, we've actually realised that those common co-occurring needs actually are the rule. That's what we see more often. And depending what research you look at, it can say that children who are autistic are, up to 80% more likely to also have a co-occurring diagnosis of ADHD. We know that children who are autistic are likely to also experience epilepsy. We know children who have ADHD are also more likely to have things like tics and Tourette's. So we know that there's so many different overlaps when we're looking at neurodiversity. And we also know that children don't neatly fit in diagnostic boxes. So, we might see children who are presenting one way and children who have got a very similar set of diagnostic labels but presenting a different way. So we know that there's this big tapestry. And Francesca Happy says it best. She talks about it as a constellation of differences that young people can have and how they can impact and how they can interact with one another.
And it's quite common in my kind of lived experience for children or adults to perhaps present with more obvious ADHD, to then be medicated or treated in, however they are for the ADHD, and then to realise then that they're autistic as well, because the ADHD has been masking it for so long, so effectively.
Yeah, definitely. And I've definitely seen a lot of those cases. So again, if coming back to that question of second opinion, so sometimes I've been involved in diagnostic discussions where I've said to families, all we're seeing at the moment is this young person's ADHD because they are so busy. They are on the go all the time. They are, racing around. They are doing all of these things. They're having lots of maybe fallouts with friends that could be put down to some of that impulsivity. And we're able to see ADHD and diagnose that really, really confidently at the moment. We think there's some autistic traits going on, or we think there could be an autism diagnosis, but we're not 100% sure in that at the moment. So that's the one that we're going to wait for. Yeah. So and this isn't saying that you then have to put your child on medication in order to get an autism diagnosis, but it might be that you put lots of different things in place at school, at home. You might go down the route of medication, but when you've got those ADHD things sort of like supported, then you sometimes see, oh, actually, yes, we can see that there's something else going on there as well.
And it often there's, and I've heard the term ADHD used quite a lot.
Yeah, that's quite new. And I really like it because it's definitely been created by the neurodivergent population themselves. So a lot of people kind of like to combine the or of autism, so AU, and DHD, so ADHD. I really like that.
It's a good shorthand as well, isn't it? So you don't have to say autistic and ADHD every time.
It does, D. Yeah, it does. I'm still annoyed about the D in ADHD, the last D for disorder in ADHD. But we'll chip away at that. We'll chip away at that next, Rosie.
Does a diagnosis ever change over time? Does autism improve as a child gets older?
Gosh, that's a big question.
Isn't it?
That's a big question, Rosie. So thank you to the parents that sent that one in. I think it unpicks so many different things. So yes, autism does change over time because we all change over time. We all grow up. We all learn new skills. We all have different life experiences. Whether we're neurodivergent, whether we're neurotypical, we all change. So we know that that's going to be part of an autistic person's experience as well. So it might be that you learn a new strategy. It means you can cope in a situation better. It might be that you learn that you can use ear loops to cope in a really busy situation, which when you're 5, you can't say to somebody because you haven't quite figured out why you're so distressed in a busy lunchroom, because all you just know is that distress, that feeling of wanting to get out. As you get a little bit older, you can recognise and maybe tell somebody, it's because it hurts my ears. And then you recognise, oh, well, if I hurts my ears, I can put my loops in, and that actually helps me feel, it helps the room be a lot calmer. So your autism hasn't probably changed, it's stayed the same, but your ability to cope in a really busy environment has changed dramatically because you've understood yourself better, or your mum or your dad or your a psychologist or someone has helped you understand that. So we know that, people don't stay the same. We know that things change. I don't like the word improve, that kind of word.
It is in inverted commas, I will say, in my question.
I know. And I think that's why it is. So for me, because I come from that different standpoint, always, I think when we're thinking about improvement, if I'm thinking about improvement from a perspective as, is that autistic person living their authentic life? Are they happy? Are they achieving? Are they doing the things that make them happy? Has that improved for them? That's wonderful. That's everything that I'd want for them. Have they improved because they're now acting more neurotypical? That's what I'd want less of. That's the bit that makes me feel a little bit uncomfortable, because what we want people to be doing is, living their authentic autistic lives beautifully and, achieving the things that are important to them. So overall question is, yes, we all change. Autistic people will change as they get older. They will learn new strategies. They will have new experiences. Sometimes those experiences might not always be positive as well. So you might have negative experiences, which means you maybe then be more wary of other situations. So you will change, you will shift. And sometimes, again, that will then determine what you're accessing.
And I'm thinking back to what you were saying about, acceptance and understanding. And if you have and I'm thinking of children who are living at home, small children, and how once the parents or the carers understand the child, they will then presumably start to make adaptations within the household, which will make the child's life easier. So therefore, they might see less meltdowns, they might see less dysregulation.
Definitely.
But I also really appreciate what you're saying about whether, when we talk about improvements, whether we are seeing high-level masking. Because actually, as you said, that isn't really what we're aiming for here. It is about people being able to make adaptations in their own lives. Things like, for a lot of autistic or neurodivergent young people, getting up in the morning is really difficult. Yep. Well, when they get older, they might be able to find a job where they start later. So therefore, their day's already going to be easier. So they're going to have less difficulties.
Yeah, definitely. Yeah. And I love that, how you kind of describe that. Yeah. So having a meltdown every day for a young person and for a parent is not a good life. No. That's exhausting. So if you then can have days where you don't have meltdowns, that is an improvement, and that's great for everybody because that's positives. And those things will have changed because maybe you've learned to, regulate yourself because someone's talked to you about your emotions. They've maybe shown you colours that help you identify when you're feeling a little bit fizzy and you need to kind of go to your calm place, or they've given you words to ask for help. Or between you and your parents, you've recognised that when this happens, then we need to do this. When I'm starting to get a little fizzy and I do A, B and C, then my mum knows I need D, E and F.
Yeah.
And then, coming together.
And actually even just understanding yourself, why do I feel like this?
Yeah.
That takes so much of the power away, really.
Yeah, definitely.
If one of my children is autistic, does that mean my other children will be too?
There is a chance that could, we know that autism, as I've mentioned already, does run in families. We know there's a genetic component, and we often see that children who are autistic then have autistic siblings. It's not it's not a definite, but we know that those chances are increased because of just the genetics involved. So what we always say to families is sometimes you may have one child who is maybe presenting more or less subtly with their autism. So they may have got a diagnosis first, and then families sometimes come to me and say, oh, but we knew that, our son was autistic because he was displaying all these very obvious autistic signs. And we didn't recognise that our daughter was also autistic because she was displaying lots of signs, but they were different. They were girl signs or they were subtle signs. So we know that, yes, we can see this in siblings. We can see this across generations. But it's not always the case, again. So it's something for families to be aware of.
And also, as you said there, you might have two children who are both autistic, but might present completely differently as well.
Indeed, yeah, definitely. So you can see two children who have extremely different profiles. That might be because they are, a girl and a boy, but again, that could be two boys, two girls. Again, we know autism is a vast spectrum and it can have co-occurring differences as well.
Yeah.
So you might have a young person who is autistic who also has a diagnosis of ADHD, would present through their sibling who just has a diagnosis of autism, would present quite differently. So again, that can be a difficult thing for some families to navigate.
Thank you.
All important diagnosis questions and answers. Next up, we're talking about the autism diagnosis journey, which naturally brings with it questions, emotions, and self-reflection. Let's delve in to explore some of the most common thoughts and concerns parents experience at this early stage. From uncertainty and guilt to hope, understanding, and learning how to move forward.
Now, my next question makes me feel a little bit sad, actually, because this is that kind of blame that a lot of parents of children with autism might feel. Is it something I did? And that's what the question is. It's, can autism be caused by something I did?
So I would categorically say no. Right. So we know now that, there's so much research about autism, about genetics, about how it does run in families. So there's lots of things that we do know for sure. And we know it's not something that's been caused by something a parent did. So a long, long time ago, when we were first looking at, autism, one of the theories was it was called by what was called refrigerator mothers. So mothers who were very cold, mothers who were very standoffish, who behaved in maybe a different way. If I think about that now, looking at it through an autism lens, that we probably weren't looking at refrigerator mothers, we were just looking at autistic mothers who were presenting in a very autistic way. And then their children, surprise, surprise, were also behaving in an autistic way because they were, part of that family. So, yeah, I think it's very much to see, I think families often feel blame and say, is it something I could have done differently? Was it something was it something in pregnancy? Was it something as when they were a baby? Is it something that I've done? And actually, all the research shows that, no, we know now that autism isn't caused by those things. Now, that doesn't mean as a parent, you don't have any responsibility, because we know actually what parents can do is help their help their children. So sometimes I don't want parents to feel hopeless and think, oh, well, there's nothing I could have done to make this better or worse. Actually, we know, it's not to blame. Please don't blame yourself. But then think, okay, what can I do to make my child's life better, to richer, to help them and understand them?
And a question for me then, what can you do?
What can you do? So I always think about acceptance first, accept your child for the wonderful human being they are. They might be different, yes. They might do things differently. They might sometimes be a little quirky. And I think one of the most important things we do know about, for all the different kinds of psychological research is children that are loved and feel accepted and feel they have the sense of belonging in their family. Those are going to be the children that have the most healthiest kind of well-being and mental health.
And I guess as a parent, sometimes there is an element of letting go of the expectation of what you had and what being a parent would be like.
Yes.
And accepting the new reality. And a child can pick up on that. They know when they're accepted, don't they?
They do indeed. There is a wonderful poem, for some of you may have heard it or might not have done, but if you haven't, please check it out. And it's called Welcome to Holland. Yes. And it's a wonderful concept. And it says, all my life I've been planning for this trip to go to Italy. I've read the guidebooks. I've learned all about Italian food. That's where I'm going. And then I, get off the plane and I'm in Holland. Mm-hmm. And it's not saying that Holland is an awful place. In fact, it's a beautiful place. It has tulips. It has Rembrandts. But it's different from what I was expecting. And I think that's a lot of parents that I talk to very much have that experience of raising an autistic young person. So it's maybe not the Italy I was expecting, but by landing in Holland, I've had to learn a new language.
Yeah.
I've had to appreciate life at a slower pace. I've had to do things differently. But that doesn't mean that Holland is worse than Italy. They're just different. Yeah.
That's a lovely analogy. So, Freya, let's talk a little bit about Google. Okay, so if I, and as I have, suspected that one of my children might have autism, the first thing I'm going to do is I'm going to Google it. What are the dangers of that? Because obviously it can show up an awful lot of results that might not be relevant to you. So what are the kind of things to be cautious of if you're going to start Googling things?
Yes. So I would say all of the things you do on the internet do with the awareness of, you know, you're not sure who's put that information out there, especially now with Google assisted AI. So you may Google something and then AI may come up with lots of information as well. Again, thinking about how you phrase the question would depend on the things that you find. So you might phrase it in a way that says, you know, how to support my child with autism. And then that might come up with something very different to how to cure my child with autism. So there's lots of different things out there. So I would say just, you know, treat it as you would with anything that you do on the internet, for example. So if I'm going to a restaurant and I look at a Google review or I go and check on that and there's maybe a mixed lot of reviews on there, I'm going to recognise that that's because it's the internet. Some will be good, some will be bad, some will be, you know, different. So kind of treat the same way. Think about what you're looking at. Think about the sources, the reputable sources. Think about, you know, that there will be some good stuff, some bad stuff. How does the information land with you? And talk to other people. You know, once you've got all that information, because there is some really useful stuff out there as well. So I'm not saying, you know, throw the baby out with the bathwater. Let's use what's useful out there. But then let's talk that through maybe with somebody when you go to talk to, you know, your teacher or your GP or a speech and language therapist. Talk through the things that you've read and then make sure that you've got that sense check.
So sort of use it as a tool rather than an overarching view.
Yes. Yeah. I think that's definitely the case, Rosie. I think that's a really good description, using it as a tool, because then you can, you know, ignore the bits that maybe don't apply to you, but also you can take the bits that are going to be really useful and meaningful. As somebody who works, you know, doing diagnoses, it can be quite difficult to sort of have those conversations with parents who very much start on well, I've looked at Google and my child is definitely autistic. And you're like, okay, that's great. So tell me all the things that you've put in and you've learned. And so I'm not going to dismiss that. I'm going to explore that with them. But then some of the things that they may have said, you know, they're really struggling with, say, planning, with sequencing, with organising, all of those things which would come up as autistic, but it's also part of ADHD as well.
Right.
So again, you might be looking at that kind of picture and it might be shoehorning you one way when actually a professional would recognise those things and shoehorn you the other way, or different things. So it's about using it as a tool. Exactly.
Yeah. Thank you. Freya, you mentioned then about AI, and obviously AI is now in everybody's lives. It's everywhere. And again, I would say it's a tool that you use. How are you seeing parents using AI at the moment?
So where I'm seeing parents using it really effectively is, as I was saying before, is using it as a tool. So putting in really good information. So if you just ask a really broad question to AI, you might get lots of broad answers back. But if you ask questions that are, you know, can you summarise for me the most recent findings that are approved by the National Autistic Society, or can you talk to me about neurodiversity affirming books, and what are the most common, what's being said in resources at the moment that aligns with neurodiversity affirming practice, or talk to me about skills that speech and language therapists use to help a young person develop a communication. So if you're really specific in how you use your questions, again, you can use it very, very usefully. And then what I always tend to do, particularly, and if I'm either using it myself or advising someone else to do it, is then go back to the source material. So if the AI is telling me, oh, this book says that this is a really good strategy, I might then go to that book and go, okay, so let's read the full book, or let's look at that book. What is the book telling us? And then you can go from there.
So again, it's quite a good starting point. And I'm thinking as well, you know, if you don't know how to do a sensory story, you could perhaps use AI to help you devise something like that.
Yeah.
So it has a real use.
Definitely.
But maybe don't take it as gospel.
Exactly, yes. So yes, and because you can create pictures as well, you can do things which are really important. So again, a parent recently showed me a really lovely example where a young person's intense interest had been really beautifully incorporated into their morning routine visuals. So this young person loves the Lego Ninjago characters. So they'd used AI to create the Lego Ninjago characters doing, brushing my teeth, washing my face, putting my drying. So again, they'd used AI to the best of AI's ability to create these really lovely images that were so motivating for this young person to go and clean his bathroom. Whilst I recommend visuals all the time, we know autistic young people thrive and find visuals so reassuring, help them with that, predictability. For this young person, he'd have done probably really well with a picture of a toothbrush or even just the word toothbrush. But a Ninjago character brushing his teeth, that's so much more exciting.
Really incentivizing, isn't it, as well?
Definitely. So you can use it really creatively, which can be really helpful for that young person.
But I think it's important to reiterate that it's not a diagnostic tool.
No, it's not. No. I mean, you can use it in ways that can help you. So again, you might put in some information about your young person if you felt comfortable doing that and saying, what are some of the things that I might be wanting to think about, or what are some of the strategies? But again, it's always thinking about, how using it as that tool and then coming back to talking to somebody about, the things that you found.
Thank you.
Should I get a second opinion? Receiving an autism diagnosis can be an emotional and deeply personal experience for families, regardless of the outcome. It's not uncommon for parents to seek another opinion as they look for clarity, reassurance, or a broader understanding of their child's needs. Let's explore why families might choose to take that next step and what this can involve.
Is it appropriate to seek a second opinion? And I'm assuming they mean after an autism diagnosis for their child. What would you say to that?
So are we thinking about a second opinion that they didn't get a diagnosis, or they got a diagnosis and we want it?
They haven't specified, Freya, so perhaps we should answer both.
I will try and answer both as best I can.
both.
I will try and answer best I can. So let's say you've been for an assessment and the conclusion was that the young person wasn't meeting diagnostic criteria at that time. So I would always advise in that case. Now, if as a parent you're thinking they've 100% got this wrong, I know my young person. I've done lots of different reading. I've spoken to lots. I know autistic people, and I'm quite convinced that they've got this wrong. What I would suggest parents do is almost have like a watchful waiting period.
Right. So
maybe 6 months, 12 months, where they sort of sit and think about, or kind of process what's happened, if the professionals have given them advice in the report that may be around, they may have formulated, for example, the young person isn't autistic, they're experiencing significant high levels of anxiety. So you might then decide to kind of go, okay, so let's do some anxiety management. Let's figure out what's going on and let's think about that. Because at the end of the day, professionals have done this assessment with the best will in the world, using diagnostic tools, and they want to get the right result for you and your child. Now, if that's still sitting with you very uncomfortably, and again, these timeframes have to be for you as a parent. So if you're thinking, gosh, I couldn't wait another 6 months, I need a second opinion right now because this isn't recognizing my child's experience, then this is something that you have to decide as a family, okay? And then that's how I would seek a second opinion. And when you seek that second opinion, I would, so in the NHS you are more than allowed to, you have to ask for a second opinion. But what I would do is I would ask for, so say for example, somebody was assessing a 10-year-old daughter, my daughter, and they'd said, oh no, she's displaying really good eye contact. She's got loads of lovely social skills. And she doesn't really have any intense interests. And that's why we said no. What I would be most likely to say is, okay, well, that was brilliant. I would like a second opinion done by maybe a speech and language therapist who's got specific skills in assessing girls who go on to be autistic. Because then I can really look at, is this a young person who's got really good social communication skills, or is this a young person who's learnt and is scaffolded and is practicing and is so effortfully engaging in these things? So I'd ask for people who are specifically qualified in different kinds of presentation.
And parents can do that. They can,
yes.
And I think that's something parents don't know, is that they do have a bit of autonomy here.
They do indeed, yeah. So yeah, and definitely, talk to the professionals, get their view. Why weren't they diagnosed? Which parts were you concerned about? Which parts, explain to me, and give me examples of how they did this. Give me examples of things that they do at home that I talked to you about as a parent that made you think this wasn't autism. And they shouldn't be just saying to you, this isn't autism, and then not giving you anything else. They should be saying, this isn't autism, but it could be this, or it could be ADHD, or it could be anxiety, or it could be, something else. And sometimes, we as professionals, we do sometimes see children who we say, we can't diagnose this, especially little ones. We're not 100% sure yet. So we don't want to diagnose and get this wrong. So we're going to kind of give advice and suggestions and, come back to us. So have those collaborative conversations with the professionals that are doing the assessments.
And as a professional, and again, I don't know whether this is something you can kind of answer generically, would you tend to err on the side of caution?
I would never give a diagnosis that I didn't feel 100% happy with. So if I was in any doubt, I would always err on the side of caution. And what's fabulous is, the teams that I work in are extremely skilled, knowledgeable teams. So if I'm ever diagnosing somebody, it's not just me. It would be me and other clinical psychologists, specialist educators, speech and language therapists, occupational therapists. So a team of people could make that decision. And again, talking to teachers, talking to parents, spending time with that young person. So yeah, I would say professionals should always be 100% sure and confident in the diagnosis that they're giving.
Which kind of brings us to the question that we don't know if we've been asked, but we're going to ask anyway, which would be, what happens if you think that your young person has been misdiagnosed with autism?
And I think that's really important. Now, that doesn't happen, in my experience, doesn't happen very often, but it has happened. I have seen children who've come both within the NHS, within private practice, and people that I've spoken to generally. There have been a few incidents where I've come across young people and parents who maybe were diagnosed younger, and they've come back and said, look, I don't think this fits me anymore. And because there's only been a handful of those cases in my career, I'm sure there's lots of cases across the country, but in my career, the ones that I've come across, there's definitely been a variety of different outcomes. So for one young person, they had the assessment when they were very little. They had then got to 17 years of age and they didn't want the diagnosis anymore. Yeah. And they said that, they'd had this assessment when their parents had sought the assessment for them. And now that they were becoming an adult, they were wanting to review that assessment. And they were saying, I don't think I'm autistic. I don't think I'm autistic. They said, I want this label removed. So we did the whole assessment and actually felt that this young person still did meet diagnostic criteria. But we did a really big piece of work with that young person about explaining them what their autism was, what their own specific unique type of autism was. Because they, everyone's different. And they were saying, so that was a really useful piece of work to help with that young person. And then I have been involved in a case which was an extremely complicated case with a young person with lots of different things going on. And actually, by the time when we looked at the whole picture, we said, actually, we don't think this is autism.
Oh,
we think at the time this young person was presenting lots of autistic type traits, but we think that was due to trauma and to, adverse childhood events that this child has been through. But this child had then been in a very stable, loving foster care. And then by the time this child had got a little bit older, we then were able to review and actually create a new formulation and a new understanding. It's not to say that the other one was wrong. It was just that's how it was understood at the time.
Yeah. So it's not something that you grow out of, which we've already addressed, but with the right support, sometimes you can see what perhaps a diagnosis was masking, would you say?
Definitely. And we know people don't grow out of autism.
No. An autism diagnosis can feel like stepping into the unknown, but with clear information, compassionate support and the right guidance, parents can move from uncertainty to confidence. If you would like to explore any of the topics we've discussed today in more detail, we will include helpful resources in the show notes, including guidance and help sheets from Options Autism and links to trusted organisations. And, as always, if you have any questions about autism education or support, you can get in touch with the team at Options Autism or visit us at optionsautism.co.uk. Do not forget to follow us, subscribe and share this episode with someone who needs it. Thank you for listening, and we will see you next time on Autism Unpacked.
Thank you for joining us for this special Q&A episode focused on some of the key concerns that parents experience in the initial stages of an autism journey. We hope these discussions have helped you see your child more clearly, provided some clinical clarity and reassured you during what can be a daunting time. If you would like to find out more detail about the subjects covered, there are full-length episodes covering these and many other topics on the Options Autism website. Until next time, keep listening and keep celebrating our fabulous neurodiverse individuals.